The Peregrine Centre is a social impact studio, and we seek to bring together clinical expertise, academic research and the voice of lived experience so we can innovate better human services. Since 2021, our Rural Mental Health Partnership with New South Wales Health has supported continuous improvement in rural mental health practice through training and research. Our Small Project Grants program has given away $1.7 million to 23 diverse projects. The projects span a diverse range of topics, but they share this focus on practical implementation for rural mental health practice. I hope that people take from this encouragement about how wonderfully committed and passionate our researchers are to improving rural mental health practice.
Well, the challenge we're trying to address and the sort of research questions we have relate to the increasing number of people who come into emergency departments with a mixture of mental health and drug and alcohol concerns. Well, the process was pretty straightforward for applying for the grant. The application process was pretty clear on the website. The application form was pretty clear. I consulted with other colleagues who were a part of the research team, and that includes people with lived experience as well as other academic colleagues and the Peregrine Centre.
Climate disaster particularly impacts rural communities, and it has a really negative effect on people's mental health and well-being in communities across the Northern Rivers. And here we have had a series of compounding disasters since 2017. And so that's the main kind of driver, if you like, for doing this work on rural mental health in the disaster context. The process of applying for the grant was really easy. And very straightforward, which was great. What we did in preparedness for that was we talked to a previous grant recipient to find out what their experience of applying for the grant had been like and their experience of implementing the grant because they were successful. And we also worked with the Peregrine Centre to discuss our idea and discuss the process of applying.
This research will be assessing whether the nature-based compassion program can reduce PTSD symptom severity. It will also be looking at other mental health and wellbeing outcomes.
I think one of the most important things when you're looking at a regional and rural area is that you have to have a really good research question. And not only that, then you have to have the right team to be able to conduct it.
We are a service that work with people with a diagnosis of functional neurological disorder, or FND. FND is a condition where people have a whole range of symptoms such as seizures, tremors, problems walking, talking, problems with memory, and they don't have a neurological cause for these conditions. It's a very common condition, but very poorly managed by health systems. It really wouldn't have been possible to do a robust research design without the funding that we received. Managing kind of that clinical research workload's really tough. We're both part-time clinicians, so without the support of that grant funding, it would have been impossible.
The Lighthouse project is looking to mitigate the lack of specialist mental health services and workforce for rural children with mental health concerns. The advice that I'd give to others thinking of applying for that grant is to ensure that you are starting out with a degree of time and clear steps in terms of planning and prepping for that application.
So the main thing we were looking at was graduate programs. So there's graduate programs for allied health in main city areas, metropolitan areas, but they don't really apply to here. We wanted to have a look and see what we could do to develop them up from here.
That I'd give to someone thinking about applying for a grant is to really think through your idea and conceptualise it. And what really supported me with that process was the rich discussions I had with Louise.
I also think the funding's been really important. Actually, the funding has enabled us to do the project. Without it, we wouldn't have been able to find the time to do it. But also it gives a sense of acknowledgement that this is a topic worth researching, and it helps us to, with that acknowledgement, build a connection between the university and industry. So really, very important part of what we've done.
Our research is addressing strategies that promote the recruitment, retention and well-being of mental health workers in rural Australia.
The Peregrine Centre provides some really useful supports when we were applying for our funding. So there's an online workbook that was really helpful to make sure that we covered everything that was needed for the grant. And then once we had the grant drafted, we took up the opportunity to meet with one of their research associates. That was so helpful because it identified for us that we hadn't quite got the language right and what we were trying to communicate wasn't really working. So it was just gold.
The main thing that we were focused on is early intervention for young people with or emerging personality disorder. So we're really fortunate. The impact of the funding from Peregrine Centre has really allowed us to have the foundation of setting up this intervention and testing it. We're now at the point where we roll out training to New South Wales health clinicians every 6 months in air therapy. So it's been a really great platform, the grant.